Good evening, Doctor. Thank you very much for your time. You know, if we look at the figures, certainly there have been many more deaths in the Western Cape compared to Gauteng. But active cases, it looks, and please correct me if I'm wrong, it looks like Gauteng has way more than double the active cases compared to the Western Cape.
Good evening, Sally, and good evening to the viewers. Yes, most of our cases are recovered, and we have much fewer active cases in the Western Cape.
How many people do you have in hospital? And I'm just saying what we know about Gauteng is that there are 2,553 people in hospital in Gauteng with COVID or suspected COVID. What are the hospitalizations in the Western Cape tonight?
The hospitalization in the Western Cape today is 1,900 people with COVID. That is with 280 in ICU and critical care, the rest in general beds. So it's 1,900. And we have an additional 700 people with suspected COVID, which is the person under investigation. So it's about 2,600 across all private and public hospitals in the Western Cape.
I see. Where are you in the trajectory of the peak and the pandemic? Because it seems to be a bit of a moving target.
Sally, what we've been doing is we've very much been planning against the national COVID epi model, which predicted that we needed a certain capacity at our peak. But what we've been doing is we've been tracking our hospitalizations and our deaths every week for the last 8 weeks, obviously against that target. And we've seen a slowing in the increase in need for hospitalization and a slowing in the increase in deaths. So we have created additional capacity, as I reported to you a couple of weeks ago, in the convention center. So today, I mean, we've created 800 beds there. Today, we've just got over 200 people admitted in the convention center. And during the course of this week, we will be opening Brackengate, which is 330 additional beds. And those beds, together with the Tusong Center in Kailicha, which has 69 beds, have taken significant pressure off our acute hospitals in the Cape Metro.
Do all the patients in hospital in the Western Cape this evening who need oxygen of some form, whether it's ventilation or this high-pressure system and all these different varieties, do they all have access to ventilators or the oxygen supplies that they need?
The basic management includes access to oxygen. So everybody that is admitted has oxygen and has access to oxygen. And we also created additional beds for high-flow oxygen. And that is for people that then doesn't need to be on a ventilator. So we have high-flow oxygen for all our patients that requires it. And we have oxygen supply for all the patients requiring. And we still have spare capacity based on the fact that we have created additional beds in the system. And we can say that over the last 10 days or so, we've not seen a rapid day-to-day increase in admissions. So we are entering a early period, and we're watching it very closely, of seemingly stabilization of our numbers of cases needing admission in hospital.
If we look at what's going on in the Eastern Cape, which of course is an area of great concern, they only have some 35,000 confirmed cases, but they've got 519 deaths, which is more than Gauteng. Now, does that speak to hospital capacity problems, do you think, or under-testing?
Sally, there is I mean, we've obviously got a long history now in terms of people being hospitalized and the number of infections, and we very carefully track our deaths. So according to us, you know, with big numbers, you should be seeing deaths, and the MRC together with Home Affairs data are now starting to track whether the deaths that we've recorded is in line with the expected deaths that they see in Home Affairs. So I can't speak for Gauteng, I can't speak for Eastern Cape, but commensurate to the numbers of cases we have, there's a certain percentage of deaths that you expect in relation to the number of cases you have. Yeah.
So you know you've moved deeper into the disease quicker than the rest of the country. So I'm wondering what lessons there are for Gauteng, for the Eastern Cape, as we start seeing our big spikes at the moment.
I think the biggest lessons for us was that ever since we had our first case and we started seeing the acceleration, I think Gauteng and Eastern Cape is now going to the acceleration that we saw about 4 or 5 weeks ago. And the acceleration comes at you very quickly. The lessons that we have is that we can look back and say that we created the interconnected network of people that supports one another. Now, in this province, we have the most incredible healthcare workers, the incredible teams of people that has worked together to get us into the place where we are prepared for what's coming at us. So it's really about being connected, relationships, trust, empathy, and just being there for one another to prepare you for going into this. The other big lesson was that we've spent a lot of time trying to engage our frontline staff with their anxieties. Staff are extremely anxious, and we spend a lot of time listening, being empathetic, and trying to be there for our staff and to support them through this difficult period. So it stood us in good stead that we have a sense of resilience to be able to cope what's coming at us at this point in time.
Well, thank you very much for joining us this evening. That's Dr. Keith Klutter. He's Head of Health in the Western Cape.